If there's one industry where there is a huge gap between demand and supply, it would be healthcare, right? Because the sheer need of the planet for care far exceeds the number of people who can give care. And care and cover, right? So care is your hospitals and cover is your insurance, right? So both care and cover are paramount for a healthier and happier world, right? That incidentally is, the Thryve narrative, right? That's my brand peg. So care and cover is important for a healthier and happier world. So how does care and cover connect in the logic of Gen AI, which means that we might not have, when we were talking to Professor Nayemullah, I said, this whole thing about increase, then he said, still somebody will need a nurse to come and, touch them and tell them that, you're feeling better or give them medicines or whatever. But then if there are a bunch of processes where technology kind of helps us to make sure that we don't go and meet that nurse, however pretty it is, the person is, or handsome if he's a male nurse, and if we can reduce that with the level of intelligence that Gen AI can kind of bring in, right? I mean, a lot of us, except for some of us who did have to go through COVID during within our families or whatever, right? We practically stopped visiting doctors during that window, right? And life moved on. And many of us stopped getting into work, right? I mean, we did remote work and all of that. Because there's so much stuff that happened. So just a quick view from each of them, and then we'll kind of circumnavigate this. I'm going to, request you to kind of pound us with a few questions on points of view on what it essentially means. So Mohan, quick one again, going back to this point on how do you think Gen AI is transforming healthcare and the entire care and cover space, and what does it mean for humanity at large? And that same question to all four of you gentlemen here.
Yeah, thank you, Indu. Considering that you're all young people, I'll give you two examples, and then we can try to build on it through the panel. One example is, work we are doing at IIT Madras. So there is Braille, right? So Braille is for whom? Blind people, right? Now, so there is a technology, there is something that has been built, there is a dictionary that has been built, and you can build data sets to store those, and you can also work on those data sets. Now, one of the challenges STEM education students face, right, is they have to learn, say, physics, chemistry, mechanical engineering, electrical machines, all those things. They are able to figure out what is there in the text. But the challenge that they are facing is they are not able to figure out what the diagram is. Now, the problem with engineering is a lot of it is backed by diagrams, right? You all know it. Anything you will say, if you refer to figure 1, so you will see an induction motor, you will see a squirrel cage motor, you will see a pump. Now, how does a blind person figure out that it is actually a pump and what is the dimension of the pump? So what we are trying to do is use generative AI to look at a text, right? So suppose you have a textbook on, say, fluid mechanics. What we are trying to do is, of course, the text part of it easily done through Braille, but the diagrams that are there, we are trying to use generative AI to look at, of course, the content per se in terms of pictures and images, and in some cases even audio and video, and convert that into a form that either through a image to voice kind of reproduction, so that a blind person can actually see it, and then at the same time even get a feeling of the sense of the contours and the dimension of that machine. See, if that happens, it is actually brilliant, isn't it? So look at all of you, any of the students here, if they are blind or if they cannot hear, the problem is the STEM education just beats them. They can't handle it at all. So that is a problem we are trying to fix using generative AI. So we are trying to use, there is a language called Julia. Have you heard of that? Any of you heard of the language Julia? It's one of the most recent implementations of enterprise ChatGPT, actually. So it's a beautiful language, script language, very nice to learn, very easy to learn. So we are trying to put some students together and see how you can convert a pictorial text into a audio representation in a way that the students can hear. Now this is very difficult to do actually. We also don't know how to do. We are trying to figure out how to do it and then see if there is some technology solution. If that happens, it will be a brilliant solution for the next generation. So that is one solution that AI is working on in terms of, I mean, I'm going a little beyond patient care. I'm looking at, the need of societies. Then there is another case. See, mental health is a big issue, for all generations, whether it is students, young people, old people. Old people want to become young people want to become old. It's a big problem these days. So what we are trying to do is, there is a company, I can give you the name. It's called Care Me Health, which we are helping. It's also incubated at IIT Madras. So we are trying to see how they can create wellness programs around, mental health. And AI is going to be the biggest enabler of mental health in the future. So when we said healthcare, Indu spoke about pharma, payer, provider. That's all related to the physical aspect of healthcare. Now we are moving a notch away because mental health is such a big issue. We are trying to see how these concepts of AI and generative AI can actually work around the mental health. And we are trying to see how that can be used to create chatbots. So if you can create chatbots, see, the problem with mental health is people need privacy, right? So they don't want to discuss either with parents or with spouses because it's a little awkward. So they like to have the comfort of doing a one-on-one conversation with a chatbot. So we are actually trying to use generative AI that will give, hopefully, intelligent answers to a question that a student or a youth or an old age person is actually asking. So these are two very good live case studies. And any of you are interested, please reach out to me because we need a lot of help in working through this. Where healthcare is actually now being put on its head, I would say, using technology. So technology is actually creating solutions which healthcare could never do in the past. So that is the kind of transformation that is happening in the healthcare space. And I'll just pause here for the rest of the panelists to speak.
Thank you, Mohan. And in fact, interestingly, I don't know, many of you might have kind of, unless you invest thinking in this, otherwise it doesn't occur to you. For me, pure play healthcare happened about 1.5 years ago when I joined Thryve. And when you start looking at it, right, so increasingly we're talking about healthcare being the last bastion for technology to kind of come in, right? Because a lot of privacy concerns, you can't really afford to go wrong, right? Oops, it broke kind of stuff can't happen in healthcare. So in that sense, it's been traditionally mollycoddled, and it's a beautiful insight, right? Especially mental health, where the entire aggregation of content can make it so much more interesting. So you have an open invitation from Mohan. So any of you who are interested, I think we'll leave Mohan's coordinates, Mohan and Anu's coordinates with Dr. Maheshwari and Dr. Naeem, and you should possibly try and explore some of these as well. Dr. Wasim?
So you mentioned specifically about the gap between the supply and demand. And in every area of healthcare, it's a problem. If you look at heart attacks, in the rural space, it's a problem. May not be so much in the cities. But when it comes to preventive care, that gap is extremely large across the spectrum. For example, if you feel bloated today, what will you do? If you go to a doctor, he's going to tell you just eat healthy. You want to lose weight today. There's really no solution that modern medicine can give you as of now. But there are a lot of things that you can do to get there. And that is one of the largest gaps in preventive health, where if you have to get some tests done to understand, okay, you're feeling bloated, you're not able to sleep well. These are only 2 symptoms. Largely, if you go to a physician or a hospital, you won't get a solution. But using AI and the concepts of algorithms and preventive health, today we are able to pick out saying that, okay, you've not been sleeping well for so long, you're feeling bloated for so long, you are gaining weight, you probably have a vitamin D deficiency. It's one of the areas where Gen AI is starting to make early inroads. One, because the chance of going wrong is very low. Recommending a test has very little privacy concerns. And therefore, one of the areas where this Gen AI is starting to play a role really is preventive and wellness, where the gap is extremely large, where we don't even have trained physicians. So when you talk about leapfrogging, when you cross one generation, this is an area of health where we didn't even have physicians, but suddenly AI is coming in and overtaking the lack of physicians themselves. So for me, that's an exciting space within healthcare, where AI has already started playing a role, and it can keep getting bigger and bigger.
So very interesting, because exactly the word Shammy and I we were discussing this morning, where from a leapfrogging perspective, right, healthcare was the last to have consciously starting to embrace AI, and its ability to be the first to make a significant impact in the communities that we live and work in. And the opportunity, for instance, for India, right, and some of you can also help us with the India story of what it is, right. We largely represent the continental United States and, 30 plus million users and all that kind of stuff. But then if you look at it, right, all of you are aware that from a digital payment system, which is the world's #1 economy, right, and it was not expected. Of course, for those of you who stood in the lines in the ATM, or you saw your parents coming back home very late because they stood outside an ATM line for 5 hours, that wouldn't be great fun. But then otherwise, with UPI and everything else, right, I mean, we kind of leapfrogged the entire world from a digital economy perspective. So likewise, our entire health ecosystem, right, with Ayushman Bharat and a whole bunch of initiatives, we have an opportunity to kind of leapfrog. Many of us do think that our healthcare systems have serious challenges, right? But can an entire digital intervention fill in for many of those inadequacies is the question. And when Dr. Wasim spoke about preventive health, right, that's a totally different dimension altogether. How can you reduce people from falling sick? There was I think from a mental health perspective, the community that would have been, I know I'll get, maybe boxed by Dr. Wasim, that got into a depression during the pandemic was the general physician, because fewer people went seeing them, because we all wear masks, right? And which meant that we had less vulnerability to a lot of infectious diseases. And we always saw, before masks became a part of our attire, I saw a lady wear a mask here. So yes. So masks became a part of our attire. We always saw a lot of the Japanese and some of the Far Eastern tourists wear masks. And you would always wonder, right? I mean, why are these people doing it? But that's such an elementary part of the entire ecosystem. We all learnt about washing hands and personal hygiene during COVID. Some of us learnt about it during swine flu, right? You guys might have been much younger then. So that entire dimension is such a different thing. And are you kind of able to kind of fathom and understand how Gen AI is going to make all our lives better? All our lives better, the lives of our loved ones better, and everything else, right? So that's the kind of narrative that we are trying to present here. Shammy?
First of all, thank you, Indu. Thanks for that question. So, Gen AI and healthcare, right? Let me make it very clear. Gen AI is not here to take away jobs from the doctors or the nurses or any of the medical practitioners. The reason is so simple. WHO says we need at least one doctor for every 1,000 people. That is the global standard. But when you consider any country, right, other than, it's not US, Cuba has more doctors per patients or the population. But in general, out of 230 countries recognized by UN, roughly 90% of them, they don't have the number of physicians to the number of people who are there. So 1:1,000 is not there. And that too, when you get into a rural and urban divide, that ratio becomes more and more pathetic. So fundamentally, this is one area, this is one industry which is calling out or screaming out loud, saying that we need to be complementing it through innovation. And GenAI is the one thing or the one technology which is trying to fill the gap. So let me give you I can give you multiple examples because this is what me and my team are doing in Thryve as part of our projects. So I will just give you one familiar example which I believe you can all relate to, right? Type 2 diabetes. It's common anywhere, whether it is US or India, it is very much common. What we normally do is, type 2 diabetes, we go to a doctor, they say that, okay, come back to us for a review after 3 months or 6 months. But that 3 to 6 months, what really happens? It might be a time where it might even spike up. Probably because you didn't take the medication or you didn't really work out. Now we are getting the holiday season starting from Diwali to New Year to Pongal. It's 2.5 months. You might miss out on your workout or you might go easy on your diet. So fundamentally there might be a time when things may not go in a way which you expected it, and you will immediately rush to the hospital, get hospitalized. What we are trying to do through digital intervention is keep a tab on all your data, on all your analytics, and then inform the doctor at the right time, saying that, hey, you know what, this patient, there is something unusual. It's going to be 6 months before he comes back to you, but till 6 months you can't wait. Very simple notification. Again, we are not replacing the doctor here, but we are bringing in the timely alert and prioritizing it. If I give you another example, probably you wouldn't have heard about this. It's called as AMD, aging muscular degeneration. It's a condition of an eye, wherein if you don't diagnose it at the right time, if you don't get treated at the right time, a person can go blind. Now the treatment is pretty simple. It's not that big a deal. But on an average, on any given day, there are 1 million X-rays which are taken, and a patient who has AMD might be in the queue of the doctor, say probably at the 600th position or 700th position. Through GenAI, what we are trying to do is read through all the X-rays and prioritize it. Maybe you have fake positives. The first 100 or 200 people are for general visit. Doctor may not even know. By the time the person who is in the queue, they come for treatment, right? The condition would have worsened. Again, we are not trying to solve it. I am not going to give him a cure, but at least prioritize him rather than first in, first out, right? Okay, this person has a condition which needs to be treated probably on a priority basis. Can we do it humanly? Definitely no, because what I told you is 1 million X-ray within South India alone. Now I consider the entire India, and that too which are not recorded, which are not documented, that is 80% of it, then you have a bigger population. So this is where we complement the healthcare system and try to make it more meaningful and deliver proper health. So that is where GenAI is making a difference.
Kind of interesting, right? This is like, how many of us have gone really hungry to a hotel? And we really want the waiter to kind of understand that and serve us the food faster, right? And as Murphy's Law will have it, the guy will come to us the last and want to serve us the last, right? This particular model of care where it's needed the most makes a lot of difference too, right? You've got an emergency and you've got a kid with just a knee bruised, as opposed to somebody who's going to be drawn in with a severe skull injury. How do you prioritize it? Where do things kind of pair themselves out? At multiple levels, right? And that's like a very naive, basic way of expressing it, not so much played out in a real emergency situation. But then it's all around prioritization. And like what Shammy was saying, it's more a US simulated exercise wherein, to meet a doctor, you have to take a very long appointment and things like that. Whereas here also, right, to meet the right doctor, sometimes it becomes a bit of a challenge. So again, it makes visiting the doctor so much more easier, or maybe not visiting the doctor and getting care so much more easier. And don't we want to all do that? Dr. Naeem?
Yeah. So our panelists did discuss about generative AI. So how many of you have not used generative AI? How many? Few hands? Okay. How many of you submitted your assignments using generative AI? That too, few hands. Okay, I am not a dean academics, all right. Now you can, I am not quizzing you. So all of you have used generative AI, correct? For assignments? Who's the bravest one? Okay. So the point is, we all have used probably many times for submitting assignments, probably for learning for the exams, the day before exams. The point to discuss is, how can we transform that for, or use that technologies for healthcare. That is really a challenge, because healthcare, it is not just you walk in, you type a query and you get a diagnosis. Long time back, I don't know, I'm not very sure this generation knows it, but there would always be a saying, don't type your symptoms in Google, correct? You have come across that? Because Google will tell you, you have so many diseases and you are going to die in the next day, something like that, all right? So that's the result, because it is so much information, probably we may not be able to interpret it right, and it is likely that we'll make a mistake. So that's the reason that you don't interpret your diagnosis. That's where physicians do come in. So the whole point is to interface the knowledge with the context and with some expert. So that would actually be what will work best for all of us with respect to generative AI or using AI in all that we do. Many of our professors are working on healthcare domains. We use machine learning, deep learning techniques. We have used AI left, right and center. We have published a lot of papers. We do all of that, and it does make probably a small mark in the knowledge that we generate with respect to using AI tools for some healthcare or some diagnosis or whatever it is. Okay, but to put it as a package, to put it as like we came to know of generative AI much because of ChatGPT. It was that probably that exposed us more to generative AI. And then all the other tools, the image DALL-E type of stuff that came before that. So the point is, how do I use this technology in healthcare, in pairing with expert physician and getting the diagnosis, and probably what like Thryve is doing to minimize the queues or to speed up the process or to eliminate, minimize the visits. All of that is actually a large challenge, and like they did say, is that this is a domain in which you are not going to have a problem of job scarcity, because people are there, people will get sick, and you need some treatment. All right. So all the tools that you can build. I think Sridhar ma'am will tell, some of her students did try to do chat bots for, of course they were talking for admissions, for healthcare, for medical diagnosis. They have done, students like you have done that earlier. All right. So the point is, can we tap some resources? So they too have come for the purpose such that they will excite your mind so that you think healthcare as a industry. And it is AI. It is what you will learn in the next 3 years here. The tools and technologies that you will learn, which probably you can refocus on a particular domain, and the domain that that is being suggested is healthcare, and there is amount of expertise required. Context is very much required. I don't know, maybe you would have seen in our website a student, maybe he passed out 3-4 years back, exactly during COVID. He just passed out the year back. They came up with his company, rather he came up with an idea for drug discovery for COVID vaccination. It was a student from among you. And they actually at that time they approached VIT also for funding, but the funding requirement was quite high. We couldn't do that, help him. But he went on to work with another company to do drug discovery. What is the most appropriate molecule for COVID. All right. So that type of, there is talent, there is technology. It's all marrying all of them together is what Thryve is probably thriving on. So probably we can, sometime later also they will, I'm sure they will come back to us and challenge us with some problem statements that we can also work on.
Have all of you heard that line by Mahatma Gandhi that talks about the customer? Do you know that line? You've not seen it in any of those stores? That customer is the most important person in the premises. We are there for them and they not for us kind of stuff. You've heard that, right? You've heard that, seen that, whatever. Now, one of the things that I've always felt, and so would all of us have, is that when it comes to healthcare, though we pay a lot of money to the hospitals and the care providers and the insurance and everybody else, right? They don't care for us as customers. Except for the time when you need to be renewing your insurance, you'll get 200 calls from every Tom, Dick and Harry, right? Your spam call just can't figure out. Or the time when a doctor is prescribing an absolutely fancy treatment so that the hospital can make a lot of money or whatever. Even then, right? I mean, you're kind of pushed to a corner or to say that, okay, if you don't do this particular procedure, you wouldn't walk the earth tomorrow type of stuff, right? All of that. Now, there is an interesting thing. Shammy just wrote a blog on data democratization and AI democratization, right? And Professor talked about this interesting thing of, doctors were, besides after the phase or before the phase of getting bugged with not enough patients visiting them because everybody was wearing masks and not falling as sick as they should have, they had this other situation where the more irritating thing was everybody was half a doctor themselves, thanks to Google. And the way in which they had to actually clarify from the medicines they were writing to the symptoms to whatever kind of stuff, right? I mean, we've all seen enough memes on these topics. So it got to a point wherein, but then that essentially means that people now had access to information. So Gen AI, what it also does is it changes that narrative of, it's not about people having information, but there is an ecosystem that has the information. It's not singularly dependent on, how much of Google search that I did versus how much of Google search that she did, right? It depends on what is a system that has done enough data search and consolidated stuff that way, right? So going back to this entire thing of what's happened with Gen AI largely is that it's putting us at the center of the universe, right? As customers, really. So I want the team to talk a little bit about what that means on empowering the human in the healthcare ecosystem, right? This entire thing of how is it making things better? Mohan talked about accessibility, right? Of how visually challenged people can read images and things like that. But then at the core of it is that suddenly we are designing designing solutions that will make the person in contention, the human, the consumer of healthcare, to be extremely important. And that changes a lot of dynamics, right? So maybe I'll start with Mohan and then do the same round robin.
Sure. But are you all aligned? You're finding this interesting? Yes or no? Okay, so please feel free to ask questions, because when you ask questions, it becomes like generative AI, right? When you ask questions, our answers will be tuned to those questions, right? So then it becomes more targeted. And the reason I said that is, Indu spoke about customer-centric activities, right? Now healthcare is becoming patient-centric. And why is it become patient-centric? Because, and I'll keep it simple so that, it doesn't go too complex. See, the biggest problem in healthcare is cost. We spoke about payers, providers, pharma. Now, for pharma industries, that is companies that make antibiotics, right? For them to discover a drug and bring it to the market, do you know how much it may approximately cost? Any guesses? Name one patented like the good old times, right? Ciprofloxacin, something like that it was called. So one of the beautiful antibiotics discovered about 20 years ago or 30 years ago, I don't know when. Take any drug now. How much do you think a pharmaceutical company would have spent before they brought it to the market? Just take a guess. Million? Okay, anything else? Let's shoot some figures. Louder guys, VIT, louder. Just take a guess. I mean, the dean is not going to tell you anything. Take any guess. Huh? 20 million. Okay. Anything else? 40 million. Multiples are 20, is it? It's like an arithmetic progression. Okay. So, in the interest of time, so it is upwards of $1 billion actually. So, how much is $1 billion? How many millions? Okay. So, any drug before it comes to the market, there is a cost of 1 to 2 billion at least, okay, before it. And why is it that way? Why does it cost so much? Louder. Absolutely. I wish we had some chocolates. So, yeah, I mean, she kept it simple, but it's the right answer. Basically, you have to go through a preclinical phase, then there are 3 phases of clinical trials, and then there is a post-marketing. So, and between all this, the trials will also fail. And when it fails, all the money that they have put in goes down the tube. So that is why, you know, by the time they come up with a very successful drug, the cost becomes very high. Now, how will they recover this price? How will they discover this cost? They have to charge it to bakras like us, right, who use those drugs. Because that's the only way they will recover the cost. So what is happening is, eventually, I'm just giving a small example in a way you will understand, the cost of medical care is very, very high because of the risk involved in creating drugs, the risk involved in doing a treatment. Now when you go to a doctor, they do lot of tests. They will also do clinical examination, and then they will try some antibiotic. They will do some culture tests. Something will work, something will not work. So in the process, eventually there is a lot of trial and error within the capability, of course, but at the same time, the cost is becoming very high. And then eventually, Indu spoke about payers, right? Payers are the insurance company. Give one name, insurance company that you know, health insurance. Star Health. It comes on TV every day, right? Now Star Health, your parents, ask your parents, they will tell you. Because you may not have claimed any insurance at your age, but check with your parents, your grandparents. You know, what happens is when they put a claim, say for 1 lakh rupees, eventually Star Health will give you only 50,000 or 60,000. The reason is because finally Star Health also needs to be profitable. They are not here for charity. So for them to make money, they have some amount of corpus they have to distribute across all the people who hold policies with them. So they come up with an Excel sheet which says, you know, for the room I will pay so much, for the doctor fee I will pay so much, for the test I will pay so much, for the medicines I will pay so much, and then they will say for all this I will not pay you. And that is how they cut down your claim from say 1 lakh to about 50,000. I am just making up something. So the underlying thing in all this is the cost. And that is what, you know, we are trying to see in this conversation also. If you are able to move to an ecosystem where it becomes absolutely patient-centric. Now when it becomes absolutely patient-centric, what are the things will happen? Use generative AI to look at an X-ray. Okay, so you have an X-ray of the lungs, and if you have a technology that will look at the X-ray and be able to give a much more intelligent diagnosis or prognosis of the problem that the patient may have, and give predictive analytics and say that this patient can have the following, then what happens is, and the same thing holds true for an MRI or any other scan that you, or CT scan, anything that you will do, then the need to do subsequent test gets negated. Okay? So the cost of doing subsequent tests, the cost of doing subsequent analysis probably can get removed. So that cost comes down. So for the doctor to diagnose a situation, it becomes easier. The cost of, hence the cost of investigation, the cost of diagnosis, both of them come down. Now the third is cost of treatment. Now how do you make sure that the cost of treatment, because there are so many drugs, there are so many methods that you can adopt the drugs, intravenous, there are oral, there are a lot of things. And if you have oncology kind of situation, whether to do chemotherapy, whether to do radiation. So if you can use generative AI to intelligently assess the condition of the patient, and with enough inputs from the doctor, create a targeted set of interventions, investigations and drugs to a patient, then the view is the cost of that treatment comes dramatically come down. Okay, so if these three things happen, that is investigation, diagnostics and treatment, if they are able to bring down these costs, and that is what generative AI is being used to attempt, and to a large extent it is definitely happening, especially in the area of diagnostics, then the cost of care comes down. And when the cost of care comes down, Star Health is happy, right? Because Star Health has to pay less. And then the patient, your parents, grandparents who go to doctors, they will find that instead of their claim being 1 lakh, the claim is actually 60,000. Star Health will give 50,000. So Star Health is happy. Your parents, grandparents, whoever goes, if at all they go, I am saying, touch wood, they are also happy. So that is what, the patient-centric healthcare will do, and that will address the biggest problem that the healthcare industry is facing now, which is in terms of cost. I'll take a pause here.
Dr. Wasim, I think you're much closer to that center of gravity, right, as a practitioner and B2C startup entrepreneur. So some thoughts on how the patient is becoming the center of the universe and how care, cover and pharma and everything else is surrounding that.
So I'll take a couple of examples. So earlier, during the Google days, now if you call our current era as the ChatGPT days, during the Google days, if you had to go and Google saying I have a little bloating here, a little pain on my right side, what do you think will come up as the answer? Which disease will come up? Sorry? Cancer. Why is that? For every symptom you will have cancer as one of the options, correct? Why is that? Why do you think it is that way? Why for everything that, every symptom that you put, either a cancer or some form of death will come? Exactly. In fact, you're right. The keyword is basically cancer had the best SEO. So that's why cancer came up as the answer for everything. So whatever symptom you put, whichever disease had the best SEO is what came up. What ChatGPT has done is made it slightly better. It's not yet perfect. But today if you put those symptoms in, it will tell you these are the possibilities. And it would say, it would very unlikely to bring up cancer as number one. It will say maybe there's a chance somewhere. But if you go back and tell the same ChatGPT, which is what a lot of doctors would do, which most patients won't do, is for us, if you go back and say, hey, you know what, but for this answer that you've suggested, this is really not a symptom, ChatGPT will say, yeah, you're right, sorry. I'm not joking. You go today, one of you type, or if you have access today, just type, say, what is 1 plus 1? And it will say 2. You say, no, it's 3. My wife says it's 3. ChatGPT will sometimes apologize to you, say, sorry, this must be right. Because it's a large language model, right? It's trying to complete a sentence. As the LLMs start to come in for healthcare specificity, we are hoping that right now it is making a list of symptoms and so far it's not scaring you to death yet. But with more focused LLMs coming in, it will start narrowing that down, which means in two ways. As a patient, as a user, if you remove the word patient, and if as a user, you have access to information which is more specific to you, and that is not taking all the information out there and just collating it and presenting to you. That is probably the largest difference that we are seeing today, where even doctors are using AI to say that, okay, I have these list of symptoms. This is not fitting into my diagnosis. Is there something that I'm missing? So that's the part where AI is playing a role from a patient side. Another area where it's playing a large role is interpreting your blood reports. Earlier, the only way to get a blood test was for you to go to a doctor, he'll write a prescription and you'll go there. Today, a large number, and including today, right? As of now, there are messages that I get saying, hey doc, can you have a look at this report? Why did you take this report? There was 20% off on 1 mg. Nobody asked me to take the report. It's been 2 years since I took a health check. But what happens is if let's say triglycerides, okay, it's one blood test, it's a type of cholesterol. Normal value is 150. If the value is 100, you'll be fine. If the value is 300, you'll run to your doctor. The problem comes when the value is 152. It is slightly above normal. Now you don't know what to do because nobody wrote the blood test for you. It's not bad enough that you have to go take an appointment, but it's nagging enough where you'll keep going and searching the internet the entire 2 weeks to see what 152 might mean. Because 150 is normal, which is slightly above normal. This is the most common conditions where patients are not coming to see us when we get WhatsApp requests. This is the largest bandwidth where tests are slightly above normal. What Gen AI is doing there is it's able to say that, okay, you've got this 152, your Q risk is so much, what is your Q risk? If that number is so much, then you may not have to worry. It's giving you a slight hint saying that, okay, maybe this is something you need to run, or you actually can stay put. So it is putting some amount of power back into the user directly.
Okay, in fact, very interesting, because as you were speaking about that, right, as much as I was kidding on doctors and what Gen AI is going to do to them and things like that, I remember having heard Dr. Devi Shetty, a famous cardiologist, talk about why in India we are making medical education so difficult, right? We make it extremely expensive, we make it extremely difficult, and full-fledged doctor, or you don't need to go through 5 years of your undergrad, another 2 years of your postgrad, plus all of your stuff to even make ends meet, right? Unless you were born rich or something like that, right? So is that going to significantly increase, as you're saying, the number? Is there an opportunity in the horizon where it's going to significantly increase the number of medical practitioners out there, and therefore, though not get to a Cuba point like what Shammy was talking about, increase the number of people who are capable of providing care?
So I think long before Gen AI came in, that movement had started, where patients started saying, okay, maybe for this particular cancer, this is the best treatment, but I don't want to go through it. I'd rather go on a holiday and die in the Bahamas, or I'll die. And this is an actual statement that a patient made to me during COVID, when his blood sugar was 600. And I haven't been treating infections for a very long time. He said, doc, I don't want to go and die in the ambulance. I'll die at home with my family. It's fine. Whatever little you can do, you do. So that power is already coming back into the patients before Gen AI. Gen AI has just sped that up. It's just helping that process where patients are taking back control of their treatment options. I'm not sure if it will help reduce the medical education, but I think the need for that itself may not be there. I think we have to look at it from a very different perspective, saying we may not need so many doctors down the line if we are able to pick up diseases very early, wherein healthcare has two parts, where there is health, there is the care part of healthcare, where how much of a machine talks to you, you might sometimes need a touch. You might need someone, you might want to feel heard. So there are parts of that where you can't replace humans as of today. And that's probably where we'll need more physicians, more physical people. And we may not need that many if Gen AI becomes strong enough to be able to guide people and give them more options early on in the disease.
I think that is the point where every time I use the word hospitality, right, you'd wonder hospital, that's the point where I guess hospitality becomes the same thing, wherein hospitals are all about hospitality, where you go in there to feel good as opposed to actually get better, because there are a whole bunch of other technology interventions that will help that. Shammy, do you want to talk a little bit about?
Yeah, one question
Please.
to Dr. Wasim. You are also looking at alternative medicine too. Dr. Mohan told that about how the cost of all of the English medicine takes raises the cost. So since you are into both, would you think going back to your roots will our traditional medicine take care of all these costs, will bring them the cost along with Gen AI? Because in acupuncture or even the Ayurveda type, those parameters are sort of fixed. Given certain input, that's the type of treatment. Would Gen AI help in that, bringing down the costs from the patient perspective?
Gen AI, I don't think so, and there's a specific reason for it. When our ancestors wrote about Ayurvedic drugs, today the soil is not the same, unfortunately. The plants that they used to treat, today that plant doesn't have the same nutrients that it had 1,000 years ago. The acid rain has depleted so much of our natural roots that what worked 1,000 years ago simply doesn't work today. It's an unfortunate situation where theoretically it's natural medicine, but the medicine itself needs to be reinvented, because tomatoes didn't belong to our land. Today it is the norm. Tomatoes came from South America. Potatoes don't belong in. If you look at our Ayurvedic textbooks, there is no mention of tomato. But that's the norm today. Where will you go and recreate the entire ancient medicine when everything where they wrote is very different from what we have today in our hands? So Gen AI may not be so much, but because we need to bring in data first of all, but where it's playing a role is probably showing that this is working in certain populations and therefore can be tried in other populations. That is definitely playing a role.
Very provocative question and a very profound answer there. So Shammy, do you want to kind of quickly segue into what the kind of pattern from a patient-centric perspective? We at Thryve talk a lot about that, right? So how are we constructing some of that? I mean, more from our experience of what it is. And
So again, hope I'm audible, right? Again, when we talk about patient-centric, and we also touched upon bringing down the cost and other things, right? So again, I will give you an abstract of one of the projects which we are currently now executing back in Thryve. But before even I get to the abstract, I'll give you a real life scenario which you might have seen. Probably, if unfortunately, right, if any one of you or your near ones have been in a hospital, and then you shift to another hospital, you take all the medical records with you, probably a bundle of records, and you might have heard the doctor say that, hey, you know what, go ahead and repeat all this test. I hope this is not some unusual scenario. Many of you would have seen it. Now let me complicate it little bit more. So in the first case, you already had medical records, bunch of records in a different interpretation, in a different format. And the other hospital which you went in, probably it is because you believe it is a specialized care, or you have to shift your location. Now they are asking you to repeat it. Now what happens if the first set of records is in a non-English language? So a person who is getting treated in Mexico, the records are in Spanish. They are going to mainland US. They want to get treated there. And that means that they want to continue the treatment from the point where they left. right? Now when you tell them, go ahead and repeat the battery of tests, that means the cost goes up, A. B, to continue from the same point where they were getting the treatment, it is going to take a lot of lead time. And obviously, this is going to make the patient nervous. Quite opposite to being patient-centric, here we are record-centric, right? And this is a very common scenario. Now with what Gen AI coming into picture, it opens up certain possibilities which didn't exist before. So one of our teams is working on an NLP-based project, wherein you give them a bunch of medical records. It is going to summarize in a very concise way, saying that, hey, this is what the situation is, this is the diagnosis, this is the treatment, this is the treatment plan, and this is how the patient had been responding. Now the other possibility it also opens us is, it can even interpret other languages and consolidate and bring you the same summary. A problem which healthcare industry had been fighting for a very long time, interoperability, right? Which we are unable to solve even today, wherein if you have records, can you make hospital to electronically communicate better? You need government to come and say a regulation, you need to put a penalty, you need to put a deadline, and then you again give them some amount of time to remain compliant. But Gen AI is not only trying to make your systems interoperable, but even languages interoperable. So it reduces the cost, it reduces the lead time, and obviously it puts the patient in a much more better position, right? So that is one possibility which is very natural because the Gen AI has come into picture, and I'm talking about a NLP project. The other thing which I can talk about, very simple case, very, very simple. It may not even look like rocket science, but we are able to do it. And this, as I speak, it is already implemented in a chain of hospitals in New Jersey. So what happens is, the most toughest part of an hospital visit is waiting. You don't know when you will see the doctor. And you can't actually blame the doctor or the physician, what you call it technically, right? Because he or she might get pulled into an emergency. There might be a case where they have to leave and go there and attend and come back. So what we just did with a simple AI, I'm not even talking about Gen AI, is we know the scheduling system, we have a patient database, so we know how far you stay from the hospital, and whenever there is an emergency occurs, whenever there is a routine which is getting disturbed due to whatsoever reason, the doctor didn't come on time, or he or she got pulled into multiple things which are of higher priority, an algorithm will trigger an SMS to you saying that, hey, from where you stay, and depending on the traffic situation, which is again available in the public domain, don't start at 2 o'clock, start at 3:30. Very, very simple. But what happens is, you just walk into the hospital, park your car, go wait for 5 or 10 minutes, meet the doctor, go back and take your car and leave. It's not rocket science, right? But again, to Indu's point, patient-centric. No one wants to come into hospital. No one wants to sit there for a longer time. Can I make use of the data which is already available? All these things which I told you, your address is there in my database. From there, your hospital journey and what is the current traffic is already there in public domain. The doctor's schedule is available with me. Just stitch it all together and create a narrative just to create an experience for you. So the two examples which I told you, right? The first one is an NLP one, which helps me to serve the patient better. The second one is a very simple one, but again it creates a unique experience. So that is how AI is making patient as a center of healthcare, not record-centric.
Professor, as an academic, where do you see this pattern play itself out? The research of CX, right? And I'm just connecting this in, right? CX and DX, right? Digital technology, DTX, or whatever. There's a huge convergence that is happening. And as a professor of computer science and engineering students that many of them are, right? The CX part of the patient-centric view of things becomes much more critical. So where do you see that play out in the context of talent out here, which would actually be the torchbearers for this entire transformation, right?
Okay. So the question is, how will the customer experience change because of your inputs? Okay. Not exactly Gen AI, not health, but I think recently, the past couple of weeks, or maybe less than a month ago, you would have got some mails from your school dean telling how many of you are interested in solving problems related to your campus, your college, your library, your hostel, correct? So you are the customer here and you have a problem, and can you come up with AI based solutions or just plain vanilla ordinary software based solutions, correct? So the point is similarly with your talent, meaning to say probably you have not gone too deep into AI implementations of neural networks, deep large language models, all of that. You will do probably in due course, but that talent pool is there. We have the talent pool here. Our students are working on tools and technologies that eases currently their problems. And similarly, healthcare or customer service is just another problem. With respect to the healthcare perspective, the tools and technology that you will use is your software knowledge, your context knowledge, what large language models somebody else built, interfaces. It's just about putting them together. Probably there are quite a lot of professors here who will help you build the tool chain, and it is easily doable. But only one word of caution. Sometime back, this is my experience, sometime back I was researching into some research problem. Okay, it was related to ICMR's some call. I was asking ChatGPT, what are all the work that is done earlier in this domain? Okay, please summarize that. So that's what he told. Please summarize all the work that is done in this domain and give me a summary along with references. Which paper quotes what? So give me references, and also I told particular APA format, put the references in this thing, because when we write reports we relearn. I looked at the report, it was very convincing, I was so pleased with that, my job got done in 10 minutes. Then I looked at the references, beautiful references, okay, so I can use it as it is, was what I was thinking. That day was over. Next day, something struck me, then I went, okay, the reference was so beautiful. This, with this disease, the title, the page number, the journal number, everything. I searched the journal number, no such journal, no such paper exists. Out of the 15, probably the only one or two, everything else was, it simply generated on its own, so convincing. So the problem I only tell is, whenever you work with all of this, is to be able to distinguish, is it correct or wrong? That's where expertise is required. You will think it is true, and it is probably not. And that, like I told you, I have been doing that research, I have been reading papers, references. When I write a reference paper, or I read somebody else's reference paper, I trust him because he would have done the research, he would have done coded correctly. That trust is fundamental. But that is broken in when you work with ChatGPT, okay? So it could be completely fictional, all right? So when it comes to medicine, probably it's more dangerous, okay? It's likely to fail. So probably what all you do with generative models, do try to find out whether what you're doing is authentic or not. Okay, so that's that hallucination part of it.
This
so
is like sabotaging that entire blockchain narrative, right? Where we talked blockchain of referenceability and traceability and all of that, and here it all sounds convincing, but then it could just be totally different. Wow, that's a very strong practitioner's view. So I think we're pretty much at the hour's end. All of you have buses to catch or lunches to eat or whatever. Happy to have had this, and of course, right, happy to help you with questions, clarifications, criticisms, boos and whoos.
Okay, this is related to, again, patient-centric. We see that the medical service in India is corporatized. So most of the hospital, they work as a corporate. And the the salary of the doctor decides on how much revenue they generate. I hope that makes it clear that I have to do the operations which is not required. And there are 50% operations in the corporate hospitals which is not really required, but they are being done to match with the salary of the doctor. How is generative AI going to help there? Or is it part of the customer-centric, patient-centric? Thank you.
That specific question that you had asked, I think the answer to that is also the answer to this, where the power has already started moving towards the patients, where a lot of times they have done reasonable research to come back and say that, do I need this or do I not? And with Gen AI, that information that the patient is getting is giving him the power to decide that I have been told that this needs to be done. Do I really need it or not? And this largely comes towards cancer and heart attacks, where there is a gray area, where the physician might tell you that, you know what, this part of the liver needs to be removed for you to be cancer free. Whereas there might be other schools of thought which says that maybe without it you can do. Now, which is good for you is something that theoretically only the patient should be making, but in today's world, it is the physician who makes that decision on behalf of the patient. Now, that is where the gray areas start to come in. Now, today if I walk in somewhere and the doctor tells me you have to remove your left hand, otherwise you will die, I'm not going to believe it. But if it's a gray area, and that's where this question of unnecessary surgery comes into play, because it is unnecessary in whose perspective? Now, for a physician's perspective, it might be 7 out of 10 people are dying with this condition, therefore do the surgery. Somebody might say, no, 3 people are not dying, so I'll take the chance. So that, the definition of unnecessary for whom comes in, which is where Gen AI is in a way starting to put the power onto the patients and say that, you know what, I'll take this chance. And for them to take that informed decision, the amount of information that Gen AI is giving them is very high.
Prompts me to get into a very different dimension, right? Thanks for asking that question. Imagine, do you see a future where Gen AI will have SLAs on treatment protocols, for instance, right? Which basically says that, you know, you've got this is your diagnosis. You've got so many clogs in your artery, this is where it plays itself out, and therefore the incidence and things like that, wherein those SLAs and protocols are largely driven off what Gen AI is going to kind of build out. And will that change the face of healthcare, wherein it's not the doctor's opinion that matters, but a stronger level of objective assessment?
Yes, but the way to get there is, that's only going to happen when we reduce the number of variables. Now today, if a physician is taking a decision on you need the surgery, what is the decision based on? It is probably based on 10 blood tests, 1 diagnosis, and 1 or 2 symptoms which bases that decision. But for it to be really AI, to be really Gen AI, for it to be really personalized, I need to understand, if there were 10 people with his genetic makeup, will that my decision still be valid or not? We don't have the data. Because
when the data comes, there is a possibility for that. It's going to be a while away.
Is going to be a while, because otherwise AI is going to make the same bias that the physician is making.
Very true. And Shammy, again, right, so we've got a hospital network called Allegheny Health Network in our ecosystem, and I liked some of the narratives Google on a platform called Living Health, and which says that you don't want patients to actually visit the hospitals, right? You want happy, whereas here you've got models where a good patient is a patient who visits most and things like that, and a lot of Living Health drives in that direction of what you will. So something a little bit, Shammy, on to the gentleman's question, on how we are as a company are enabling this entire Gen AI driven narrative for better patient care and for the elimination of biases or vested interests in driving care.
In fact, there is a whole movement called as population health management, and that the very reason what we or how we do that is we don't want even any of our member to come and get admitted in a hospital or stay there for a longer time or rush to a emergency, right? How do we do it? We do it by bringing in a lot of programs and personalized care. So through GenAI, as one example which I already pointed out, diabetes or any chronic illness which is characterized by you have to take medication for a very prolonged period of time, right? Earlier, before GenAI, these programs were there. So this population health management is a very age-old concept, wherein we took a chronically ill patient, segmented them, saying that, okay, these people have issues with renal diseases, the people have cardiovascular one, these people have a different type of diseases, right? And we are rolling out programs at an en masse level. But what GenAI has changed today is, it is not a population health management anymore. It is individual health management. So now I specifically know what this person will need. In fact, we are getting onto a stage wherein we will also be customizing the drug. So today if you go and say that, okay, I have so and so, they give you a very generic drug, which is applicable to a person who is 30 plus, who is there at the age of 50 plus, and so on and so forth. But what we are getting there, or what we are trying to do now, is understand the gene sequence, store the data with this, understand the historical responses to a drug, and even customize it for whatever they need. So the whole idea or objective behind all this program, I can keep talking about it because this is a multi-year, multi-million project, right? But the objective is, can we do enough to prevent a patient from stepping into an hospital? Can we increase the wellness quotient? And how do we do it? Not just one time, but continuously monitor, incentivize them. This is something like, okay, you go to the gym, then we will reduce your premium by X percentage because now you are adopting to a healthy lifestyle. So this is something which we have been very focused on in ensuring that our members are having a peaceful time with their family at their dinner table. How do we do that? And that is how GenAI plays a major role in this whole initiative.
As much as Shammy was saying this, right, I think GenAI's role would be for a member to not become a patient, right? When you have an insurance cover, but you don't have to use that insurance cover in a hospital, right? I think that will be the ultimate nirvana for the way this whole thing plays itself out. Any more questions?
So my question is, like, I am a research scholar here. So, like, have you heard about nanobots? So, like, nowadays, for last some years, nanobots are on research, basically in health sector. So, like, there is some applications like nanobots are used for detecting and detecting a cancer cells and for killing the cancer cells. So, like, how much extent will it be successful, and what in upcoming years, like, how it will change the scenario of healthcare sector?
Very startup question. Mohan, do you want to kind of explore that? And of course, Dr. Wasim as well. Talking about nanobots and where that kind of navigates and changes the face of healthcare.
I mean, I will not hazard a guess on how it will help. So I would want Dr. Wasim to answer that question. I know nanobots, but I don't know how this is going to impact.
So one of the use cases of the nanobots so far has been with endoscopy, and it's an area where the nanobot has started to play an active role, and it's a very simple pill that you swallow, and it takes multiple shots of your intestine and it gets passed out in your feces. Now what's interesting is that while common things like cancers and gastric ulcers and all that can be figured out, was the role of the microbiota. Now, Ayurveda has already taught us long ago that your entire health is based on your gut. But they didn't tell us what it was. They said it's based on your gut and left it at that. Today I think we know that the gut microbiome plays a huge role. There is a gut-brain axis and there is a lot more to it. Nanobots for that sense has started giving us results. But again I'm coming back to the question of what is normal. Now earlier we have a reference to say that this is how a normal stomach would be. Today we know that everybody's stomach is different. So what is normal for you may not be normal for me. The microbiome makeup for you may be different than it is for me, and therefore might predispose me to different diseases. So that is probably where I see the nanobots coming into play, because the gut is a safe space for it to explore, blood is not. But before we have sufficient amount of reference material to say that okay, for these subsets of people, for South Indians, this is how the gut looks like. For somebody in Northwest India, this is how the gut looks like. Till we have that, the nanobots will still play a role in gathering data. And I think it is still a few years away before that data that is gathered can then be referenced. So today, in my opinion, it is still at the data gathering space. Can it help with solutions? It can. How it will help, we don't know today.
Yeah. I think we're fortunate to have a Dr. Wasim and a research scholar face off on that. So thanks for that very smart question.
Thank you, sir.
Soon AI will be in the future. AI will be there. AI will play a vital role in all the sectors. And as you said, in healthcare, we need some emotion, some touch. Okay, and that is only provided by doctors. And my question is, if AI suggests a medication, which the doctor opposes it, or doctor suggests a different way of medication, does that mean that the trust in the doctors is questioned? I mean, the patient's trust in doctors is questioned, because there are some medications, for example, as you said, sir, if you take type 2 diabetes, and the wound, in type 2 diabetes, the people who have it, their wound will not be healed, like it takes some time for them to heal, for the wound to heal. And if AI suggests amputation, or doctor suggests that let it take some time, so it puts a patient in a situation where their medication is like where they are they cannot decide what medication to choose. So how will you answer? How is that?
Yeah, I think the question is stemming from the fact that maybe the doctor knows everything. It's not unfortunately how it works. When a doctor says you have to amputate, why is he saying that? So it comes from data saying that with 20,000 people who have this particular amount of infection in the leg, if you don't amputate, the infection will go to the heart or the brain and the person will die. It is also data science. Just that the amount of data that a human brain can process is much lesser than the amount of data that a computer can process. So if you're able to put in 2 million data sets into the computer and says that, you know what, maybe for this particular condition I have analyzed 500 different data points and therefore amputation is not necessary. It is data. The physician is also using data. He is saying I read 10, 20 papers, but that's all the brain can process. So it is not about who was right or wrong, it is about who has processed more data and therefore coming out with an answer with a certain reference, with a certain proof saying that I am saying this because this is what I have studied. And the AI is saying, no, I am saying this because I have gone through 200,000 more. I'll give you a small example of the Google's Retina. The Google did a beautiful retina imaging program, tested it on 1 million people and said, you know what, this can pick up diabetes very early stage and can predict a heart attack about 72 hours before it can happen based on how narrow the retina is. They said, you know what, in Africa there are no doctors, let's go deploy it there. Went and deployed, everything came out negative. Why? Because the African eye has melanin, is black. The data was tested on white people. It is all data science. Some what the human brain is processing, some what the computer is processing. So sometimes there will be errors that we don't foresee. But now we know that, okay, we need to test the data on people. That's why I kept saying that where is the reference? The gut makeup for a South Indian might be very different from somebody in the North. Might be some guy is South Indian today, but his ancestors came from Europe. So those individual data sets, as we keep getting populated, and it's not much time, in my opinion, in 5-10 years, we will have the genetic makeup of most of us. And when that happens, I don't think it will be the trust, it will be as to the doctor will no longer make that prediction. It has to be that, okay, so even today, should I give you a lipid lowering drug? How is the doctor taking the decision? We put that data into what is called as a Q risk. If that Q risk is more than 10%, I'm supposed to give you the drug. If it is less than 10%, I don't have to give you a lipid lowering drug. So even today we're using those things where I can't process that information. If you come and stand in front of me with your 5-6 different data points, I cannot calculate if your risk is more than 10 or not. We're already using the computer. And that particular Q risk is one example. I think that usage will keep increasing more and more, wherein at some point it will come to say that every time I need to prescribe something, I will cross check to see that is this valid for you or not, especially when it comes to something like an amputation.
Sir, so sir mentioned about hallucinations in large language models. So there are more problems like that when it comes to generative AI and LLMs, and it's hard to imagine AI solutions in mental health space without LLMs and conversational bots. So, and sir mentioned a startup who are tackling that mental health issue, right? So how are they like tackling these challenges?
They have not yet tackled, they are trying to tackle. So everybody is learning now, right? And the way they learn, right or wrong, it's based on the data that they collect from patients. Of course, this has a different connotation, and I don't want to get into that today in terms of healthcare privacy. There is HIPAA and all that stuff, but that is for a later conversation. But keep in mind that this is work in progress as of now. The reason why in mental health they went for conversational AI and also predictive is because more in terms of the delicacy of the issue and where they need direct conversation instead of going through a third person. So how effective or the efficacy of that we have to see. There is a view that some amount of counseling will need to be there at different points in time to figure out whether the conversation is in the right track, and also the treatment that follows it is also on the right track. So we have to see how it evolves. It's a challenge that we are facing because it's a new field, but definitely some part of the problem is being addressed. And our view is once we get more and more data, then NLP and all that will take over, and we'll get into some kind of more intelligent assessment.
It is a problem. It is what it is. I think as the models get better, it might evolve. There was one paper which spoke about how AI can get depression. Forget it hallucinating. It also goes into apparently depression. It was a nice paper, but it is what it is. I think it looks like it'll be strange if it happens, but it looks like at one point if the AI gets fatigued, we'll end up with the same problems that we have today as the human getting fatigued. Unfortunately, I don't have an answer for it.
So maybe
good
it's
thing
more
or bad thing, sorry. Good thing or bad thing about this is this AI gen is creating new diseases actually, which was never known earlier, or symptoms or situations in various patients where they look at it and they say, oh, I went through the same thing 30 years ago. So that is a very interesting model that we are seeing.
So do you think it's more suitable only up to the wellness domain and not to the treatment domain when it comes to generative solutions?
Only time will tell. I think only time will tell.
So
Yeah, I don't think it's one against the other. See, the treatment definitely, I think there are cases now because targeted healthcare is definitely a reality now. So the treatment part of it definitely happens. Now, how the diagnostics, all that is going to play out, we have to see. It's still early days.
I think the questions totally liven things up, and when the gentleman there was asking about touch and feel, I thought he was going to get into the
realms of humanoids and things like that. That's a totally different ball game. So thank you so much. I think this has been a little bit of a dipstick for us. We'll remember to carry most chocolates next time, and maybe not have this post-lunch, which is never a great idea. So we'll figure some of that out. But I really hope that some of you, as a takeaway from this, the time that you've invested in us, get a hang of some of these things that are fads and fantasies and the reality. And of course, the biggest deal about healthcare being an interesting industry for you to explore. And then Thryve might be one of the companies. Mohan's companies could be one of them. You could be working with Dr. Wasim or whatever, right? So there's a world out there waiting. And if we can make the world a better place, then AI and healthcare is a lovely combination. Thank you so much. And happy to connect as we slither out of the stage. So feel free. Our coordinates are with Professor Rajeshwari, Maheshwari and the rest of the team here. Feel free to write into us. Mohan gave you an open invitation to participate in some of the programs that he's doing with IIT Madras. So I think there's a lot of opportunity out there for those who are inclined. Thanks for being a wonderful audience, and thank you so much, Mohan, Dr. Wasim, Shammy, and Dr. Naeem. I think all of you brought in so much wisdom and depth and a breadth. And most importantly, right, we had a veteran, we had a young Turk, we had a practitioner, and we had an academic, right? Obviously, the academic stole the thunder from all of us. I could see much more energy every time he spoke, but I think this has been a wonderful experience for us. And personally, we're going to get this better and better, and look forward to coming into VIT for another session sometime on something. But thank you so much.